recording this. Good evening, everyone. My name is Professor Satish Krishnamurthy. I am the Vice President of Indian Chamber of Youth Entrepreneurs here in UK. And I know that we all aware of the thing that India is undergoing some huge impact because of the corona. The second wave has taken considerable impact on every one of us. And we as an Indian diaspora, having seen the loved ones of all our motherland, our heart is going really badly, actually, to be honest. And what we were thinking is, we are thinking either to send money or we need to create an immediate impact, because this immediate impact is very important. Because please be aware that exactly the same problem we undergone here in UK. We are coming after 5 months of lockdown, 5 months, not 1 or 2. And it is like going out from house arrest to parole. That's what we have been doing. And we thought that we should want to share our feelings and also the process which the doctors have followed, so that the panic will reduce. So that is the whole point out that we can create an immediate impact. That's the whole point of this program, how we thought that bringing in doctors from different specialization, and also we want to really considerate of Indian audience, because these doctors are coming up with different language specialization, because we know that India is broad. So we wanted to make sure that we at least try to cover within this 1 hour at least 4 languages or 5 languages. So, and without any further ado, I know that it is already 9:30 in India, and you are all under mental pressure as well. So I will just run through the program quickly. So next is a kind of a quick introduction of Tejinder Sekon. He's the president of ICYE. He will make initial remarks, and then an introduction to doctors, and then they will make some initial presentations. And after that, you have a Q&A session. These Q&A sessions is like you can type it in the box, or say some of them doesn't want to type. Probably there is a raise hand option is there. If you go to the reactions, if you click reactions, you can raise hand. Then definitely the our moderators might allow to ask you the questions. And if we will take the questions if it is in the regional language, people who doesn't want to express in English. So we have people from Tamil, Telugu, Marathi and Hindi, and obviously they'll take English as well. So those questions, we want to be as interactive as possible, but repetitive questions, please avoid. And anything is not clear, please let us know. This program is especially meant for you. This is our feelings, because we really heard that we wanted to do something for you all, at least to create an impact. And thank you so much for coming. I know that it's late. We appreciate that you're already coming in large numbers. It's already 66 people. And thank you so much. And Tej, over to you.
Thank you, Satish. I would like to welcome each and every one of you. My name is Tejinder Sekon. I am the president of ICYE and the business owner of a company called property company called Red Sky Homes Limited. ICYE is the organization of young entrepreneurs here in the UK. As we all know that now the situations back home in India are really bad. So we can feel the pain here by sitting in UK. We have gone through this pain from last 12 months or so. Like Satish said, we've been in lockdown for 5 months now on payroll. So we were fortunate enough. Some of our members, like Dr. Venu, Dr. Vajender, they are doctors. So we are here to help, and we can share our experience with our friends and families back home. So this is just the beginning of our program, which we started it today. And we wanted to help as much as we can with the money, with the support, with the sessions, whatever we can do. So I won't take much of your time. We come to the point. I would like to welcome Professor Venu to take it. Please started. Thank you.
Dr. Venu?
Good evening, everyone. I'm a consultant orthopedic surgeon at King's College Hospital in London, and I do hold other academic and leadership responsibilities. I'm also the current vice president of this organization, ICYE. And I'm going to share some information and some of our experience during the first and second wave of COVID pandemic in the UK. But let's remind ourselves about this horrible disease. The coronavirus disease 19, COVID-19, was first identified in Wuhan, as we all know, in China in December 2019. That was not long ago. And it took about little over 3 months for WHO to declare it as a pandemic, as it was spreading very rapidly and very globally. And we know that so far, 153 million people have been affected worldwide, and this resulted in over 3 million deaths, and which is very, very sad to hear. And again, in India, over 19 million people have been affected, and we have seen over 2 lakh deaths already. And that is certainly very concerning for not only for people living in India, but everyone worldwide. So let's just go back to what we have learned during the first wave of COVID pandemic. At the beginning, no one knew what to do, but we very quickly realized that prevention was the best key. We decided, we came to know that contact tracing of infected people or various other methods to try and constrain that spread of the disease was quite effective. We also realized that most medicines we thought would work against corona weren't working. So that was quite a difficult situation, but now we have a lot more established scientific literature. The work that started during the first wave continued, and more scientific evidence is coming out. And now we have much better treatment protocols. And in fact, there is a kind of international approval for many of these protocols. And also the experience during the first wave led us to develop a vaccine. In fact, many vaccines have been developed, and this is unbelievable because it's never happened anytime in the past at all. So we thought, we went through the first wave and we developed a vaccine, and then the second wave hit, and it hit UK very hard because a new mutation, new variant developed. And when these variations or mutations are very common, but if a mutation results in certain changes, then it becomes a variant of interest or variant of concern. And variant of concern is quite a concerning one, and it happened to be one of those among the UK variants. And we came to know that that was spreading very rapidly, and unfortunately we had to go back into the lockdown, which we have recently partially come out very recently. And it was a real race against the spread of infections and mass vaccinations. And there was a good vaccine uptake. And positive news is that we have seen a rapid decrease in infection once this massive vaccination was set in place, and once we have seen more than 40% of vaccinations and so on. Even though this was a variant of concern, quite concerning variant, but still we have seen a fantastic improvement. And it looks like we're going to soon return to some degree of normality, but we still have to carry on with precautions until this disease comes under control globally. We have to continue maintaining these precautions. So what happened in India during the second wave? And we all know that, and in fact, we also, the scientific and medical community also felt initially that if Indians were naturally immune to this disease for somehow, and it was also felt that hot weather will protect against infection. And there's no doubt that various agencies were complacent. And we have seen large crowd gatherings, but there was less vaccination or vaccine uptake. And the initial spread in India was due to UK variant of concern. And that really spread like a wildfire. And in fact, that led to the development of Indian own variant, which is associated with double mutations, whereas the UK was single mutation. And currently, this is considered as a variant of interest, which is not a variant of concern yet. And even the World Health Organization thinks that the Indian variant may be potentially more transmissible, but they acknowledge that more studies are needed to confirm that. So during the second wave in the UK, so these represent the UK new cases, daily new cases, and daily deaths. And during the first wave at peak, we saw about 7,000 new cases per daily at the peak. And during the second wave at its peak, we have seen about 65 to 70,000 at its peak. And the daily deaths, the wave corresponded to the daily cases. So during the first wave, we have seen little over 1,000 deaths in the country. During the second wave, we think we are much better prepared. The death rate it was higher, but not much higher. But if you look at the Indian second wave spread at present, during the first wave, the now daily cases were around 100K at its peak. Now during the second wave, the numbers keep rising, and we all know that to yesterday it was 4 lakhs. The daily deaths were proportionate, and again just little over 1,000 during the first wave. Now we see around 3,700. So let's go through what happens to any person who develops COVID. A person develops symptoms without knowing that has COVID, or has been exposed to a COVID environment, a COVID person. The way we diagnose is by doing the PCR test. It is not 100% accurate. We all know that. Most patients or most people experience minor disease, and they require only over-the-counter medications such as paracetamol and home remedies. But it is critical that they follow strict isolation. That is really critical, so that the infection doesn't spread to the rest of the family members. Very few, about 6% need hospital admissions, and still many of them don't need anything more than simple supportive treatment, maybe antibiotics, steroids, and so on. But very few proportion of them require intubation or ICU. So, but what is happening at present? Well, unfortunately, as you saw from the graphs, large number of patients are becoming positive, and that naturally leads to a lot of panic reaction. People become very anxious, and we know that we have limited healthcare access even during non-COVID period. But more patients and more people are seeking hospital care for various reasons, and that is diluting the limited healthcare resources we have in India. And those in real need are not really receiving the much needed help. It's mainly because many patients who could be managing this condition at home are seeking treatment. So with that introduction, I think it's time to let my other colleagues take you through rest of the talks, which are very interesting, ranging from vaccines to in-hospital care treatment. So I will now let my colleagues take over. Thank you.
Thank you, Dr. Venu. Is it next is Dr. Venkat is in the list, or who is that?
Yes, Dr. Venkat.
Sorry, Kanti in the list, is it? Okay.
Dr. Kanti, yes, thanks.
Dr. Kanti, please. Dr. Kanti is from India. So thank you so much, Kanti, for coming in this pandemic time, and your presence really means a lot to us, and your continuous support as well. Please, over to you.
Yeah. Can I share my screen?
Yeah, yes, please. You are allowed to share the screen. Yeah.
I hope it is.
Yeah, it is visible. It is visible. Yeah, please continue.
Yeah. No, thank you. First of all, I mean, the Indian Chamber of Youth Entrepreneurs, Mr. Tejinder, Mr. Satish, and my fellow speakers, Professor Dr. Venu, Professor Dr. Venkat, and Professor Dr. Vijendra. And thanks a lot for the concern, and thanks. I mean, this is so nice of you, I mean, to have this kind of initiative and to share. And like what Dr. Venu, I mean, mentioned, I hope, I mean, we have seen also in this pandemic that we are all sharing our knowledge and we are all sharing our, I mean, experiences. And we thought that, I mean, if you see how the wave started from China to US, Europe, and then it came to India. So probably we were thinking that we were more prepared and to learn from the others. Okay, so I'm going to speak on the one another very interesting thing, like Dr. Venu mentioned, about 85 to 90% of the patients, I mean, don't require any, probably they have a very mild symptoms and may not require hospitalization. But it's equally important that how do we take care of those patients or those cases who are positive and at our home. So I'm going to share, I mean, the protocols which are followed by in India. And in India, as you all know, that we have a central government, a Ministry of Health and Family Welfare. They actually provide us with the technical guidelines to different states. And the states have to manage their own states. And probably most of the states usually adapt these guidelines. So I'll restrict myself, I mean, to what are the broader guidelines, I mean, given by the government of India for the different states in India. So how do we, I mean, define an asymptomatic case? So asymptomatic case is that case where you have a RT-PCR diagnosis, I mean, positive, but as of now, Dr. Venu mentioned that it is almost 60 to 70%, I mean, sensitive, and we get only that many results. But as of now, this is still a standard we use, and we, of course, there is one rapid antigen test, but RT-PCR test, we consider this as a gold standard. And the patient has to be positive. Patient doesn't, should not have any symptoms, and the oxygen saturation should be more than or equal to 94% at the room air. So this is a definition of an asymptomatic case. For a definition of a mild case, again, the RT-PCR has to be positive. You need to have a mild upper respiratory symptoms and or I mean, fever. There should not be any shortness of breath, and oxygen saturation should be more than 94% at the room air. So this is very important. How do we, what is a symptomatic case and what is a mild case? So for any patient who is declared as a asymptomatic case or a mild symptomatic case, has to be given home isolation. Now, who will decide the home isolation? Actually, the patient themselves cannot decide whether they are supposed to go to hospital or whether they are supposed to stay at home. But what they need to do is, I mean, they need to go to a doctor. Now, in different states, probably the different regimes are there. But at least in Maharashtra, where I'm there in Mumbai, there is no need of a prescription from a doctor. Initially, I mean, doctor had to prescribe. It was mandatory that only after doctor's prescription you can go for RT-PCR. But now anybody can go and do an RT-PCR. But no sooner you do an RT-PCR, your all the information is, I mean, logged in, and government can access all the information you have and whether you are RT-PCR positive or not. Then if you're RT-PCR positive, you need to, I mean, consult your own doctor or the doctor, I mean, given by a municipal corporation or the district authority or the government doctor, whichever is available. And they will decide whether you are a mild case or a symptomatic case and what kind of treatment you require. So it's not the patient who can demand, it's the doctor who will say. Then they'll decide on various parameters. So they'll require, I mean, find out whether they have any requisite facility for isolation at home and to quarantine family members. So that was one issue. If you remember, as you mentioned, Dr. Venu, when there was first, I mean, wave, we saw a lot of patients, I mean, coming from a slum population where they didn't have, I mean, this kind of facility. So institutional isolation facilities and institutional quarantine facilities were also created. Now, with the second wave, we have, I mean, many cases from the high rises where they have sufficient space in the home where they can isolate or quarantine themselves. then there has to be caregiver. So if the patient cannot be a single person in that house, there should be some caregiver available 24/7 in that house. Communication should be there between the caregiver and the hospital. That is also one more requisite. And elderly cases who are more than 60 years and with comorbidities, I mean, they are also, I mean, allowed, and even immunocompromised patients are also allowed to stay home for home isolation only after a thorough examination by a medical professional, and they decide whether they should be for home isolation or whether they should be in the hospital. And because this is a still I mean guideline, I don't know whether it is everywhere or not, but the caregiver and the close contact, I mean the government has recommended prophylaxis by hydroxychloroquine. Then the patient should be I mean the positive case should be in a well ventilated room. He or she should be away from the family members. The patient should always use a triple layer mask, a surgical mask, which is, I mean, available all the times, or use N95 masks whenever, I mean, that patient is going to come in contact with the caregiver. The mask has to be discarded and after decontamination with 1% sodium hypochlorite solution. Patient has to be, I mean, completely, I mean, not bedridden, but at least should take rest and completely hydrated. Follow respiratory etiquettes, and he should not share any of his personal items. I'll come to the management later. And this is a monitoring chart which is recommended. The patient himself or herself should, I mean, look, I mean, what's the temperature like, heart rate from the pulse oximeter, oxygen saturation, and so on. And this is from a patient who was at a home isolation. One of my colleague, Dr. Anand Nikalge, who was monitoring a patient. So this kind of, I mean, chart the patient used to maintain and send through a WhatsApp or by email to the doctor. And the doctor will decide based on this chart whether the patient requires any hospitalization or patient needs to come or so forth. Then the caregiver, I mean, as I mentioned, there should be a caregiver for every case at home. So that there are certain precautions which the caregiver should also take. I mean, the caregiver should use triple mask or N95 masks while coming in contact of the, I mean, case. There should be, I mean, the proper use of mask. I hope this has been a very, very, I mean, sensitive issue that people are not using the mask very properly. That's not a topic here, but very important that we need to educate everybody that how do we use a mask very, very properly. Then disposal is also equally important. How do we, I mean, dispose that, and we should avoid touching to face and mask. So these are few things which a caregiver is supposed to do. Hand hygiene is another important component which caregiver is supposed to do. Caregiver is a person actually who is supposed to take care. Actually, if there is a big family, they should decide that a single person who is going to take care. I mean, taking care means provide, I mean, medications, providing, I mean, food and everything. So that person. Hand hygiene. After every contact with case, I mean, he should follow thorough, I mean, washing with soap and water for 40 seconds or alcohol-based, I mean, hand rub he should use. Of course, the linen which he should use should be also dedicated and should not share with that. Or he can do frequent hand washing or using with soap and water or alcohol-based soap as frequent as possible, or after the hand is, I mean, dirty. If by chance or if whenever that caregiver is exposed to the patient, so what actually basically, I mean, that they should avoid a direct contact. If by chance they have to go for some reason in their, I mean, room, they should use, I mean, disposable clothes. And of course, like I said earlier, there should be no sharing of utensils, dishes, or linen, etc. Food should be provided at home. So usually what they do is, I mean, they keep patient keeps himself or herself locked in room, and you just place the food or whatever you want to serve in front of that room. Just knock the door, the patient opens the door, takes the food inside, and consume the food inside. Nowadays, I mean, disposable, I mean, dishes are also available that also could be used. Or if not, those dishes, I mean, the patient himself or herself, I mean, should, I mean, wash. And basically, I mean, attached toilet with bathroom should be available for the patient so that he or she can, I mean, carry out this. So the idea is, I mean, they should not share. Of course, I mean, the evidence now probably says that through fomites, I mean, there is no possibility of transmission, but still it is better to, I mean, err on a more on the cautious side and to, I mean, follow all these precautions. Then the patient should use, the caregiver, of course, like I said earlier, should use mask, I mean, triple mask all the time, not the cloth mask, the surgical triple mask all the time. And or if possible, N95 mask when coming into the patient contact. The disposal is, I mean, very important that, like I said earlier, I mean, after using the mask, I mean, it should be, I mean, soaked in the 1% sodium hypochlorite solution for some time, and then it should be, I mean, disposed. And of course, the hand hygiene is equally important, like I mentioned a little while earlier. Now, what treatment is actually, I mean, advised? Again, the treating doctor has to, I mean, prescribe the treatment, and however intelligent the patient may be, he or she should consult the doctor and not take any medications by her or his own. So communication with treating doctor is exclusively, I mean, very, very important. Report has to be immediately, I mean, he or she has to report to doctor immediately once there is a deterioration and the symptoms and the chart we saw a little while ago. The patients who have comorbidities and have COVID, and they should continue their whatever treatment for hypertension, diabetes, or chronic kidney disease, or whatever disease they have. I mean, that treatment has to be, I mean, continued. There is no change in that. Then usually the doctor prescribes symptomatic treatment either for a fever, cough, running nose, or etc. Again, the treating doctor will decide. Then patient can do warm water gargles or stimulation twice a day. Then tablet paracetamol. Usually, I mean, this is the medication mentioned in the guideline. Tablet paracetamol, tablet ivermectin, inhalation. I mean, budesonide. I hope there is a recent, I mean, evidence that this is helpful. So that has also been included. Then very, very important, and you must have definitely the news must have reached there, the kind of situation causing out of this remdesivir. So definitely there is no role of remdesivir when the patient is at home. And it is the best doctor should decide whether you require remdesivir or not, where you should be given remdesivir. Steroids are definitely, as per the protocol, is not, is not indicated, is not indicated at home. And of course, I mean, the doctor will decide. I mean, you should not decide whether it is a mild or moderate case, and doctor will decide whether steroids is to be given or not. And you must have also been, I mean, hearing where probably one of the reasons currently everybody is saying why the complications are high, various other complication is because of the overuse of, I mean, steroids also. So, I mean, self-medication is also not a thing. Then this is very, very important that when you need to seek help or seek medical attention, or when you are supposed to go to a doctor, or immediately call the doctor and tell that there is something wrong. So when you have a difficulty in breathing means when you walk and you're not able to take your breath completely. That is one. Then the oxygen concentration, if it is below, that means less than 94% on room air, that is also one sign. And persistent pain or pressure in chest. And fourth is mental confusion or inability to arouse. So these are the four, I mean, key symptoms. If you, I mean, come across this, then you're supposed to report to your, I mean, doctor or seek medical attention. Then when to discontinue your home isolation. So 10 days after the onset of the symptoms, or there is no fever for 3 days, then you can discontinue your home isolation. And there is absolutely no need for testing after home isolation period is over. Now, because of lot of, I mean, anxiety, people are going and testing their home whether they have come negative or not, just because to allay their anxiety. But RT-PCR, you know that it's a very useful resource and should be used only for those patients. So as per the protocol, there is no need to test after the home isolation is over. Now, surveillance, this is the part of the which the government is already doing. I need not emphasize more. I mean, the staff has to be in touch with the caregivers. I mean, they need to, if SOS, if required, arrange for the transfer of the patient from the home isolation to a hospital. And the family members and close contacts have also they are supposed to be in touch. And as soon as if there is any symptom, or as soon as there is an indication, they should be also, tested for RT-PCR and treated whichever is required. Now, this is for the home isolation. Now, the other term used is quarantine. Now, actually, quarantine is used for the, contact. There is a difference between isolation and quarantine. So, who are supposed to be quarantined? Only the contacts. Contacts are supposed to be quarantined. Now, what is a contact? Again, the definition of the contact is any person who is living in the same household of a COVID-19 case. That is a contact. If by chance you have come into a direct physical contact without wearing a personal protective equipment, or if you are wearing and if there is a breach, then also that is termed as a contact. Or if you are in a closed environment or less than 1 meter distance, or if you are in a air travel with a COVID-19 case. So all these, if you have all these, any one of this situation, then you are a contact and you have to be, quarantine. Okay. Now you have to be, what you have to do into the, when you are home quarantine, again, you have to be at home. Your movements have to be restricted. You are not supposed to go, outside your, home. Then if it is possible, you can be there in a separate room. And if it is not possible, then you should maintain a distance of 1 meter and you should preferably stay away, or you must stay away with the elderly population or family members who are having a comorbid situations. Then all other standard instructions which we said for the, say for example, hand hygiene, use of mask, and all those things which are applicable to a COVID case are all applicable to any case who is at a home quarantine. And that home quarantine again can be over after the 14 days from the time of the contact. Again, there is no need of to do an RT-PCR unless and until you developed any symptom. So thank you. This is in very short about the protocol, home protocol, which is followed in India. Thank you so much.
Thank you so much, Dr. Kranti. It's very much useful, I presume. And I know there is a hand up from Sureka Mangalagi. Unless it is really urgent to specific and you are leaving, I'm happy to take your question very quickly. Else we reserve the question a Q&A session once all the presentation is complete. Okay, and Daveen Mangi, so please wait. Is it okay, Sureka? Will you be staying till the end?
Yeah, it's okay. It's okay.
Because we wanted to make sure that everything is continuous. Then after that, we'll take the Q&A session. So
okay, sir. Okay.
Thank you. Thank you. Please go on mute. And next is, I think, Dr. Venkat Subramaniam. Please, sir, go on.
Good evening, everyone. Thanks for organizing this wonderful evening. This is very much needed in this time of need. I thank all my co-speakers and the participants who've taken the effort to join us today. So I've been asked to briefly talk about the management of patients in hospital, what happens. So Dr. Kranti in detail elaborated how to manage the patients at home. So I'm just going to go through our UK experience, what we did here. And as you would expect, the resources are limited anywhere in the world when a pandemic strikes you. However well equipped you are, however well funded you are, still all the countries have been exposed how the funding is inadequate in the healthcare sector. And UK is no exception, and India is no exception either. So going into the, can I have my slide, please? So as Dr. Kranti mentioned, we can categorize a patient as mild cases and moderate cases, severe cases. Just going into mild cases, these are majority of the patients, fortunately, are going to be mild cases. And some of the patients are mild initially, and then they can progress to be moderate or severe cases. So if you take mild cases, these are patients, these patients could be symptomatic patients or asymptomatic patients. So asymptomatic patients, they don't need any treatment. So just look after your hydration, some breathing exercises is good. And most importantly, isolation is critical. Although you're asymptomatic, you need to make sure that you do not pass on the disease, the infection to some other member of the household or your neighbors, or who may be immunocompromised or who may have comorbidities, and that could be a serious outcome for them. So, and if you are asymptomatic and you are sharing a household, sharing a house, it's important you wear a mask and follow all precautions as asymptomatic patients with self-isolation. In symptomatic patients with mild cases, they may have very mild symptoms. It could be something as simple as just a loss of smell, loss of taste, which is quite common. Some people have mild fever, mild cough, and feeling very tired. In UK, we often found men had more symptoms of body pain and tiredness, and for some reason, women were got away with more milder symptoms. And the treatment for the mild symptoms are, as Dr. Kranti mentioned earlier, symptomatic treatment. If you have body pain, fever, just paracetamol. And back home in India, it's marketed as Crocin. If it is a 500 milligram tablets, it's better you take 2 tablets 4 times a day. And it can be taken in empty stomach as well, if necessary. And if your fever does get higher and it's not controlled between paracetamol, you can also have ibuprofen in between paracetamol. And if you're having ibuprofen, make sure you don't have it on empty stomach. If you're forced to take ibuprofen, please do take some antacid medications or medicines which suppress acid in the stomach. They go by common trade name Omaze, omeprazole, lansoprazole. They're all the same. You need to have one of those every day. Make sure your hydration is good. Make sure you drink plenty of water, especially the weather warming up in India. It's critical you maintain your hydration. And especially if you're going to be isolation, you're going to be self-contained in a room, you can, before you know, you can lose a lot of water through sweating, and you can get dehydrated. So please make sure your hydration is well taken care of. The tablets you can supplement. Vitamin D is proven to be helpful, and so is vitamin C. And so all these patients who we categorize as mild are those who have saturations greater than 94%. If you do have some difficulty in breathing and your saturation is less than 96 but above 94, lying in prone position when you're lying in bed is helpful. Can I move on to the next slide, please? So going on to moderate patients, when there is no relief after a week, and if you do have saturations dropping close to 94, then especially if the access to healthcare is limited and where the resources are exhausted, we are justified in starting steroids as long as you don't have any contraindication. And the recommended dosage here is 6 to 8 milligram daily for 7 to 10 days. Now, it's important you don't start the steroids too early. Steroid is an immunosuppressant, and when the viral multiplication is high, when it's at its earliest stage, if you take 2 steroids too early, it may be detrimental. So please don't take it too early. And if you are taking steroids, please do take omeprazole or PAN 40, 1 every day. Paracetamol for fever, again 4 times a day. To prevent, you can sometimes get a secondary bacterial infection after any viral infection, and to prevent that, you need to take some antibiotic. The commonly used antibiotic in UK is azithromycin. That's available in India as well, or it can be replaced by doxycycline as well. The azithromycin is 400 milligram tablet, 1 tablet just once a day for a week. And if it's doxycycline, you initially start off with 200 milligram for the first day, and then 100 milligram every day for 7 days. Again, maintain your hydration. There is evidence of steam inhalation, subsaline nebulizers are helpful. And do monitor your saturations at home. If the saturations drops below 92, you need to get medical help. There already, I've seen some questions about CT diagnosis of COVID. There is no correlation between CT findings and the clinical progression of the disease. So you do not need CT to diagnose COVID. And the severity score on the CT scan again bears no correlation to the overall outcome of the patient. So please don't worry about the CT scoring system. Saturation is the critical monitoring parameter, and patients who drop down below 92%, they need medical attention, and they may need oxygen supplementation for that, you need to access a doctor. And in severe cases, hospital admission is required. And there are various treatments in severe cases. And the main thing is a supportive treatment and make sure the oxygen saturation is maintained. And these patients, the oxygen saturations are maintained through various means. There are different things called CPAP, high flow oxygen, and we monitor certain blood tests, and we give anticoagulation therapy to prevent blood clots. And some patients are even, there is a need for ventilation. I'm not going to go into the details of managing a patient in intensive care, but we'll take some questions as we go. Thanks for your time.
Thank you so much, Dr. Venkat. And I know that there are still plenty of questions are coming. So we will definitely give everyone opportunity for the questions, and we will group them as well so that repetitive of the questions can be avoided. And last but not the least, Dr. Vijendra Ingle. I think he's one of the motivating factor as well for us in getting the things done. And yeah, so he's kind of another bubble wants to do something really good for the society and community like all the other doctors equally. So without any further, Dr. Vijendra, please take care.
Hello, hello, can you hear me?
Yeah, we can hear you.
Okay. Thank you, Satish, for your kind introduction. First of all, this is a good opportunity given by ICYE to communicate directly with our fellow Indians. And mainly, I can see some familiar faces.
Sorry,
Voice
Dr.
is breaking.
Hometown Aurangabad in Maharashtra, so hi to them. I think.
Dr. Vijendra, you are just breaking. Okay. You are just breaking actually your voices. Can you please?
Hello? Yeah.
Yeah, we can hear you now well. Yeah.
Okay. Is it okay now?
Yeah, it is okay. Yeah.
Okay. So the basic thing now is, everybody knows about the virus. The wave is going on first, second, and third in waiting, all these things. But how to go ahead and treat this? And as you all know, that vaccination is the only thing. Vaccine, vaccine, and vaccine. So that's the only thing which we could delay the crisis or get better from this one. I think I got a message saying that we can't, it's not visible.
Yeah, no, I will make the arrangements. You please continue.
Okay, that's fine. So vaccine wise, the vaccines, as soon as the virus came in, the vaccination program started in US, UK, India, all over the world. Various countries have started the vaccine. And the way it happened in UK is that once the vaccination, scientists have started vaccination program, the best thing what they did, the UK government did was from December onwards, vaccination was started. As soon as one vaccine came in, it was introduced in the community. Then January's second vaccine, December came Pfizer. And then in January, AstraZeneca Oxford, that is Covishield came in and it was given. As the vaccines came in, 1, 2, 3, 4, all vaccines were given. And same thing, because of that, you can see now is at present in UK, we are into second phase of unlocking ourselves. That is because of vaccination, because vaccination wise, about more than 90% of people, more than 50 years of age has been vaccinated in UK. And because of that, I think by June 22nd, we are planning, in UK, we are planning to go unlocking ourselves in a better way. When it started in India, because now the second wave is very actively going on and the crisis in India. At present, vaccine is the important thing. And we have Covishield, Covaxin, and now the Sputnik vaccine is in India as well. So what we need to do is that vaccinate as many people as possible. And no matter what vaccine you get, you don't worry about that. You are still safe. Because each vaccine will give you protection. Even single dose of vaccine will give you protection. And even if you get COVID, at that time you will have a mild to moderate symptom, maybe sardi, a little bit of cough and cold, and then it will be fine. That's why don't worry about the which type of vaccine you are getting. You get one vaccine, that is very important. Initial stages of vaccine, you have seen that there were hesitancy in Indian community for getting vaccine. So earlier days, vaccines were available, but people were a little bit hesitant. I know a few people who were saying that, oh, should I take it or not? I encourage them to go and take it. So now as it is available, everybody should go and take vaccine as much as possible. And I feel that whichever vaccine is there, we should get, because if you concentrate on one or two vaccine, you will have limited dose, and having a population of 1.3 billion, we will need more vaccines to protect our people in India. So for that reason, whichever vaccine, whatever dose we have, we should get it and give it. So what's happening now is in India that most of the time, people are thinking whether I should take this or not. So that was the main concern in India, because everybody was saying that, is it safe? So answer is yes, it is safe, because what's happening is that it was tested by the scientists, then it has gone through phase 1, phase 2, phase 3 trials. It has gone through all these things, and all the data has been analyzed. And after analyzing this data, the scientists have proven that this efficacy is good. So each vaccine has been passed through all the criteria of efficacy and safety, and then only it has come out to the population. So that means it is safe. Each and every vaccine will have little bit side effects here and there, so you should not worry about that. So that was the main thing. And the expected high standards, because sometimes they say that, is it safe? But yes, it is safe, and efficacy is very good. Most of the vaccines are like 90%, 60%, first dose 60 to 90%, other vaccines 91%, Pfizer 95%, the Sputnik vaccine, which is coming in India now, they're saying is 90.6, 91.6%. And initial stages, it was decided for Covishield in UK as well, that we will give within 28 days, or that was the trial. After the trial, it was decided. But considering the fact that one of the studies, like many studies were done, but some studies said that if you delay the vaccine a bit, and after that you get immunity, which is more than 90%. And at the same time, it gives us an opportunity to vaccinate more people in the same period of time. So that increases your safety wall, safety mechanism. So that's the reason I think in UK it was done from 2 to 3 months for the second dose. So that is the second point. And sometimes the myths is that people think that, okay, so usually the vaccine takes around 8 to 10 years or something for a whole process. So how is it possible that they are doing in 1 year's time? So this is a myth or question. So what happened is that these scientists, so all the scientists, the analytical data and all the phases were compressed, and they were analyzed faster. And during that process, what happens is that the duration and the quality was maintained, but within the shorter duration of time, you got a vaccine. So the other myth was that the vaccine trials didn't include different group of people. Yes, it did. So answer is yes, it did. The trials included very diverse range of participants, and it was trial was done in different countries. So most of the vaccines, different communities, volunteers were taken for this trial, so that we have a different variety of data. The next one was the vaccines were developed and approved too quickly. It was approved too quickly because on the emergency basis, but there were no cutting corners. Whatever criteria are required for a vaccination to be passed, the authorities of food and drugs in all the countries, they have regulated that, and they have seen to it that all the factors were checked. The other one is The vaccine isn't, the another myth was that some questions were there that it is not suitable for vegans or vegetarian people, vegans, so they don't eat meat and for religious reason. But it's not like that. It does not contain any animal product or eggs. That means it is suitable for vegans as well. And other myth was that I have already had a COVID, and there are some questions also coming up. So this will answer their question as well. The question or the myth was, I have already had a COVID, so I don't need to be vaccinated. So it is advised that everyone gets the vaccine. As we don't yet know whether having COVID-19 in the past will prevent you from catching it again, or how long that immunity will last. So in that situation, it's better to take vaccine. But other question was that, so when should you take the vaccine? The thing is that if you have had COVID, at least 4 to 6 weeks is the guidelines. So after that, you need to take a vaccine, then you should. The vaccine, the other one is that the vaccine could give you COVID-19. It was a scare in India when the initial vaccination was given, that will the COVID vaccine will give me? The vaccine cannot give you COVID-19 because these vaccines are inactivated viruses into that. So getting vaccine and getting COVID may be a chance, because it's not because of the vaccine, but the situation is that you might have got the infection few days before that, and the symptoms appear after that. So maybe it is a coincidental finding. So, but it's not a contraindication for anything. The other one was the COVID-19 vaccine affects fertility. So there is no evidence suggesting that. So it's not to worry about that. Vaccines in pregnancy, the vaccines have not been tested in pregnancy, some of the vaccines, but recent studies have showed that Pfizer and Moderna vaccine, they have done recent studies in US, and they have said that it is okay to be given. But its best thing is to talk to your obstetrician and gynecologist and then decide whether to be taken, whether it is safe or not. You can decide on that. COVID-19, so can we give it was again, another question was that if the breastfeeding mom is there, so can she be given that? So it's possible, yes, you can have it. It's safe to be given as per the WHO guidelines. So I think this is all about the myths and facts about the vaccine. So first and foremost is wherever you are, whichever vaccine you're getting, go and get a vaccine, whatever is that. There will be mild side effect here and there, little bit paracetamol or crocin tablet in India is enough to take care of that. If there is more symptoms, you can contact your local physician, but don't hesitate, go get vaccinated. And that's all I would like to say. Vaccine, vaccine, and vaccine. And one more thing I would like to tell before I finish, that on behalf of Indian Chamber of Youth Entrepreneurs, ICYE, these myths and facts about the vaccine and other aspect of this, we are coming out with the flyers. These flyers will be in different languages. So we are trying to give this into most of the languages in India, and we will circulate online. Thank you very much. Thanks.
Oh, excellent. Excellent, Dr. Venu. I think Dr. Vijendra, I think I'm a great fan of vaccine, as you all know, that that is the only cure, actually, to be honest. And you put it very nicely. And I think we all need that anyway. So without any further ado, I know that there are plenty of questions. I know that Shobna and Ganesh is already in the form of what to do, what not to do. So I will leave it to that. Probably before Shobna, I think there are two important hands came up. So if you can give them the preference, I'll leave it with you to do. So over to you, Shobna and Ganesh. Thank you so much.
Okay, thank you, Satish. Maybe I think we'll ask the two people who had their hands up to go first then.
You can call, actually. It is Sarika, is it? Or I forgot the name.
Is it Sarika? I think is Sarika first.
Yeah.
Sarika, would you like to ask?
Sureka?
Yeah, Shreka. Yeah, sorry.
Yeah.
Shreka.
Remdesivir, I'll ask the question in Marathi. रेमडेसिवीर सारखे अल्टरनेटिव्ह मेडिसिन बाजारात आलं आहे का?
I think the question, Dr. English.
Yes, I can take that. रेमडेसिवीर सारखं काही अजून आलेलं नाहीये आणि रेमडेसिवीरचा इथे सुद्धा इंग्लंडमध्ये देत नाही आम्ही आणि इंडियामध्ये सुद्धा त्याचा जो इफेक्ट आहे आणि त्याची जी जास्त करून रेमडेसिवीर पाहिजे असं जे सांगतात त्याच्यासाठी घाबरून जाण्याचं कारण नाहीये. रेमडेसिवीरनी जर बरे झाले असते तर इंडियामध्ये एवढी डेथची संख्या झाली नसती, कारण रेमडेसिवीर खूप लोकांना मिळतं बट ते बरे होत नाहीत. त्याचा अर्थ असा आहे की रेमडेसिवीर इज नॉट द क्रायटेरिया टू गेट क्युअर फॉर COVID-19 आणि अजून रेमडेसिवीर सारखं आणखी कोणी असं रामबाण उपाय असं काही आलेलं नाहीये अजून. आणि तरी बेस्ट थिंग इज दॅट जेव्हा ऑक्सिजन इम्पॉर्टंट आहे आणि जेव्हा ऍडमिशन लागतं ऑक्सिजन सॅच्युरेशन कमी होतं तेव्हा डेक्सामिथाझोन जे स्टेरॉइड टॅबलेट आहे ते जास्त इम्पॉर्टंट आहे. आणि त्याच्या व्यतिरिक्त ब्लड थिनर्स म्हणतो आपण, अँटीकोअग्युलन्स, जे कोअग्युलेशन किंवा क्लॉट होतात ना आपल्या रक्तवाहिनीमध्ये क्लॉट होतात त्या क्लॉटसाठी त्याला डिझॉल्व्ह करायला अँटीकोअग्युलंट देतो. सो ते इम्पॉर्टंट आहे. आणि रेमडेसिवीर च्या यामध्ये 1 ते 2% थोडासा तरी फरक होतो बट इट इज नॉट बीन proved or studied that it helps to act against COVID.
Thank you, दादा.
पण एक औषध देतात तिथे, पण तो पण काय रामबाण उपाय नाही. बरोबर.
Dr. Jendra Ingle, can you please translate the same thing in English so that other people can also?
Okay. So
there is a request asking for translation, please.
Okay, thank you, Satish. That was a good point. Just to tell you about this question, the question was that how does remdesivir have action, or is there any alternative for remdesivir? That was the question asked by my friend Surekha. And this is the point is that remdesivir here in UK is not been given, and in India it's seen that it's been given quite a lot, because there are some theories and some studies from Indian doctors. They say that it is helpful, but as far as the overall global studies is concerned, remdesivir has not got much effect on this COVID-19, and is at present there is no alternative as such to that replace COVID remdesivir and give it to treat the patient. Because one more thing I would like to tell for our Indian viewers, that if remdesivir would have been very helpful, many patients who have unfortunately died in India would not have, and we could have saved many with remdesivir, because I know many people have got remdesivir and still they could not make it. So I think that's also one of the points to prove that it doesn't help much. However, if you concentrate more on oxygenation, oxygen saturation, maintenance of that, dexamethasone, steroid to decrease the inflammation in the lungs, and apart from that, coagulation therapy, I think that would be the more better criteria apart from supportive medication. Thank you, Sudesh.
Cool. Thank you, Dr. Ingle. I think we have one more person who has raised a hand. So it's Samaya Venugopal. We'll take the question and then we move on to the questions we got during the session, which are on the screen. So I will just, can we unmute her, please? Or him? Just a second. Yeah.
Here am I.
Yeah.
Doctor, post after the discharge of the patient, do we still have to continue the isolation, especially when we have small kids around, like a 5-month-old and a 6-year-old at home? Do we have to continue the isolation, or what do you suggest?
Yeah, can I take this?
Yeah, please go ahead.
Yeah. And my other colleagues can also add. So usually once the patient is discharged from a COVID care center, this is not mentioned in the home isolation protocol, but I'll tell you what is the current practice. So after it is discharged, they are requested to isolate themselves for a week when they go back to the their respective homes. This is then for an additional precaution, and there is no scientific basis for it, but they are supposed to isolate themselves and use all the standard precautions like what I mentioned.
And can I add one more thing into this? Because the patient who goes home, even if at home for isolation 1 week, he has to take all the precaution, including the mask.
Yeah.
Thank you, doctors.
Okay, thank you very much. I think we got one more hand raised. It's Mahendra Gharat. We can unmute him and let him ask the question. Yeah.
Yeah, good evening.
May I
Can you
request
hear
the
me?
participants just tell that where you are coming from, etc. That will help us actually. Thank you.
Yeah. I'm Mahendra Gharat. I'm from New Mumbai. I'm also the vice chairman to ITF London. This is the biggest transport federation. What Santosh Parker suggests me. So 4 or 5 my colleagues are also joined to you. I'm a politician. I'm also the union leader, and I'm dealing daily 15-20 patients who require the ventilator beds, oxygen beds, remdesivir, a lot of demands, and we are very much fighting for these beds. Also on the vaccination, there is no supply of vaccinations are also very less, and a lot of questions because I have to work around the clock for this. Last lockdown also we have support a lot of peoples. But what happened? I know when UK you have the disciplined peoples, but in India, everybody who got positive, he asked, find me the oxygen bed, find me the ventilator bed. And when we go to the government authorities, there is no any arrangements. And when I go to the private, I have to talk more than 25 to 30 hospitals to get the bed. And very much panic about that. We are not getting the bed. Nearby my village, we are living in the Ulve Node near the New Bombay. More than 12 to 15 people died nearby my village because of lack of they are not getting the ventilator beds. So all this happening from last 2-3 days, people are asking for the vaccination. There is a supply of very less supply. When I'm talk about the Raigad district of Raigad, what yesterday the collector said we get only 517 remdesivir injections. How they can supply the lakhs of people in Raigad? The requirement thousands of remdesivir injection, and every doctor suggests the patient's relatives that you should bring the remdesivir injection. So this is all happening in this our area, and I hear about all Dr. Ingle, Dr. Raimane, and all the doctors. They are speaking how to make the quarantine, how to use the mask. But still, I think our marriages are going on. There is no discipline, and how they are spreading, everyone taking lightly. What the
Sorry,
yesterday, Palghar
Mr.
collector alerted
Mahendra,
us.
Mr. Mahendra, can you please tell us what's your question is? So that would really help us
My
to answer.
question is that just you are talking about what is how to quarantine, what to make the vaccination, that is all. But there is no any monitoring systems. In UK, if someone get the positive, you can get admitted. Here we have the question that lot of people get the positives. They are panic and not getting the admissions. And all this not on the vaccination. There is no any answer in the governments. I am also the politician, but I seem to say there is no any
I can
monitoring
take that,
system.
Mr. Garat sir. I'll answer that question, Mr. Garat. Thanks for the question. We all are having a constant touch. We are in touch with the situation in India, and that's the reason with ICYE has come up with this one, so that we try to get awareness among the people, not to panic. And even if you get positive, that doesn't mean that you need to go to hospital. And that's the main reason we are having this program. So I would like to tell you that, and we are going to come out with some leaflets or flyers which you can circulate as a politician and a leader. You have mass base there, so you can communicate in the local language. We are trying to communicate this in many languages as much as possible in Indian languages, and that you can circulate. One more thing you can do in your group is that you can tell them that even if it's positive, that does not mean that you should go to hospital. Monitor yourself, If the utmost you can do is that whichever house there is a positive case, you can help them getting a pulse oximeter. And if the saturation goes less than 94, that's the situation where you should start for thinking about oxygenation. But 90%, 85 to 90% people will not need admission, and just plain paracetamol. In India, it's crocin tablet. Crocin tablet, that's enough to take care of that apart from supportive measures. So thank you, Van.
Can I add to this? Vijendra, very nicely summarized. Thank you for a very, very valid point, Mr. Mahendran. The most important thing is the awareness, education of people, and people like you have a massive role in helping a big country like India. And so they will listen to you more than doctors, to be very honest. Someone very powerful, someone who's looked up onto. Your words will carry a long message, and create awareness, ask patients not to panic, and a very small proportion need admission. And the importance is creating awareness about isolation early and looking after the hydration and monitoring oxygenation. Even big countries like America and UK and all European countries, they've all struggled. It doesn't justify India struggling, but just to make you aware that in spite of so many struggles, there are things which individuals can do, take responsibility on, do. And you can do only what you can control. So we need to focus on that and educate, create awareness about people not to panic. And a good example is remdesivir. And there is a lot of talk about not unavailability of remdesivir adequately in India. And there is no definite evidence that it is essential. So please don't worry about it. One of the, there are lots of expensive medicines talked about in India about the cure for coronavirus. Remember, there is no cure for coronavirus. Prevention is the only proven, that's vaccination. And all the other treatments are aimed to support the body get over the effect of the virus. And one of the cheapest and oldest medicine, the dexamethasone, I think it costs about 10 rupees, I believe, one tablet. And that is the only one that has been proven extremely effective in patients with moderate to severe disease. So a lot of people can be treated at home, and avoiding unnecessary admission is critical. And that has to be through awareness.
Yeah, thank you so much, Dr. Venkat. I think one of the questions that Mahendra was asking about is...
Can you give me just 1 minute? What Dr. Vijendra Ingle and Dr. Venkat Subram said, that we need. And this is the very important point of this meeting, because a lot of people getting positive or get the symptoms. They just want to go join the hospital. But what they have advised, that is more important, and we have to make more awareness in this case. Thank you.
Yeah, Mahendra Garat, what we can do is like in the chat window, we will put our email details and contact numbers as well. So we will, if you share your email address there, we can send you the flyers when it is ready. And there could be opportunity that some of us may be able to connect to you separately in case if it is required. We are happy to support that as well. And just wanted to share as a common public, and I'm also a professor in a university. We have more than, I live in an estate, more than 90% of the people got the coronavirus second wave, but we never gone to hospital. Everyone was inside the home, drinking plenty of water, 14 torrid days. We were sitting at home. Other people are giving food to us. We're not even able to cook because we're nearly dead. But nothing happened to us. We recovered. And this is a proven case. All we need is, as Dr. Venkat clearly said, education and awareness. We never need to panic. And that has to come from locally, regionally, and nationally. So with that, I will pass on to our excellent colleagues, Shobna Iyer and Ganesh. I know that there are lots of hands are raised. Guys, please understand, there are lots of questions are also there. So we will complete those questions and then we'll come to the hands, please. Thank you so much.
Thanks, Satish. And I would also like to mention like some of the questions what people are asking at the moment. We already got those questions in the list. So let's go through the list first, and if we have some spare time at the end of the session, we'll go through some verbal questions again. You guys can see my screens, right? The first question I picked up is, could you please guide us on the diet and exercise to be followed post-recovery?
So there is no there is no specific diet necessary. The most important thing is hydration, and vegetables, fruits have are the proven immune boosters. So please make sure you have adequate vegetable intake and some fruit intake, and carry on with your normal medications that you normally take for other illness like diabetes, blood pressure. Please make sure you continue with that. And hydration, be prepared to feel tired. And some people feel tired for a few days, some can feel tired for a month. That's quite normal. Don't worry about it. And you do not need to go to hospital for that.
Okay, thank you very much.
Yeah, I just add gentle exercises at home without exerting too much. I think that would be enough for that.
Okay, thank you very much. The second question is, can CT scan show and confirm COVID-19?
Yes, so I mentioned earlier, CT is very widely used in India to categorize the severity of COVID illness. Unfortunately, it is not proven to correlate with the clinical condition of the patient. So in essence, you do not need a CT to diagnose COVID. RT-PCR is the best way to diagnose coronavirus. And once you diagnose, the best way to look at the severity is oxygen saturation and how the patient is. You don't need CT to say that. CT can look really bad, but the patient may be very well. And CT can look very mild, but the patient can be having severe illness. So how the patient is more important than how the CT looks. So please don't waste your money on CT scan in the early stages.
Great. I think the next questions come regarding asymptomatic patients. What is the kind of period of isolation after the first test? And from when should you start counting the days for isolation?
Can I take this? It is from the onset of the symptom. So for example, if you develop the symptom on 1st of January, then 10 days from there, that is the ideal cutoff, not from the RT-PCR. Yeah.
What happens, doctor, when you got an asymptomatic patient that doesn't show symptoms?
Okay, no, in that case, then after your diagnosis of COVID from the RT-PCR, from that day you can count 10 days from that.
Right. And in the case of no other health issues, after a couple of days being tested.
Shobna, can I just add here, as recommended 12 days, 14 days instead of 10 days, even if it's asymptomatic, if it's positive, I think here we go for 14 days.
14 days, right. And post-home isolation, what are the do's and don'ts after they've been in isolation for 14 days? Are there any particular recommendations that you would mention?
No, all the standard precautions like use of mask when you are outside. After 14 days of your isolation is complete, and practically all standard precautions what others take, that precautions you have to take. No other special precautions. That means avoiding to go into gatherings. Avoiding going outside unnecessarily. When you are going outside, wear a mask. And I saw a question of using a double mask also. Yes, nowadays, there is some evidence they say that when you are going outside, you can use a double mask. Ideally, the WHO has recommended the mask which has a polypropylene cloth into it, which can repel. This being a aerosol generating procedure. Aerosol generating. Mode of transmission. So it has a repellent property. So any mask which has that kind of material would be good. Yeah, thanks.
Thanks.
I think there was an earlier question we missed before going this. One of the questions was, I've had both my vaccinations, but After both, I didn't have any symptoms. Is that normal? Is that something to be worried about?
No.
It's not.
I think that's good. There's nothing to worry about because I had taken 2 doses of Covishield. I had option of Pfizer and Covishield, but considering the fact that I want to communicate with India, so I opted for Covishield, and I can tell you that nothing happens. It is a good thing that you're not required to take any medicine. That's good, but you're immune, not to worry.
Some people feel very tired after the first dose or second dose, and some had no reaction whatsoever. It is just the way your body reacts. So please don't worry if you have no reaction for the vaccine.
Okay. Just on that point, I mean, how safe is it for people in the age group of 18 to 25 to take these vaccinations?
It is safe. There is no question about it. It is safe. There is in UK, there is because of the blood clots in some Covishield, that is AstraZeneca patients, what they've decided is to avoid Covishield or the AstraZeneca vaccine in younger patients in that age group, 18 to so less than 30. The reason for that, the incidence of blood clots is about 1 to 4 per million patients, and it's as low as that. But when you take the risk-benefit ratio, because a younger patient are even less likely to be affected by the coronavirus, still the risk-benefit slightly shifts. Although the vaccine is still effective, if you have a choice, they've suggested avoid AstraZeneca and go for the other vaccines. If you don't have a choice, if you have a choice, just either I'm having Covishield or no vaccine, I would say go for it still, because the proven the proven effects of COVID is there to be seen by everyone. So if you're caught between the devil and the deep blue sea, you're better off taking the vaccine rather than not taking anything at all.
Great. And can you take a combination of different vaccines? What's your recommendation?
Sure.
What happens?
Sure. Shobana, just to interject that, I've been actually answering the questions from the bottom.
Yeah.
And it includes that as well. Because I thought that we may not be able to cover all questions. So from the bottom of the list, some of these questions. So you can see my answers as well. But yeah, the answer is at present it is not recommended.
Can I say something?
A combination, yes. Go on.
Hello? Hello?
Yeah, who is this? Simi, yeah? Simi Wallace?
Yeah, actually, this is Mayur. Yeah, my name is Mayur Nagrale. I'm in London, actually. What I am trying to say here is, I mean, it's nice that we're all having this discussion and, trying to explore different things that could be done. My humble request is, because we have some medical professionals like Dr. Ingley and some other doctors on board, I would suggest to have a small, because it's important that we reach common people, because, we are privileged here to have video chats and everything else. We pretty much understand what is happening, but I think there's a lack of communication, there's a lack of understanding within a lot of Indian communities, especially towards the village part of it. So if a short video by some of the doctors, describing how to live in a house when there is 5 people staying in the house, 1 person having COVID, or what is that they can do in the house, and what are the things that basically can be done without having to panic. If we can circulate these videos to local or politicians like Prashant, we have Prashant Ingle on board. I mean, he's got a bigger reach. Then we can forward these kind of small videos, which has a message and a much more educational, message for the people to know. I think these videos could be reached through common people who will probably understand it, because it is said by their own doctors from their own communities. So if somebody can take that initiative and, supply these videos to people in India, they probably will be reached much better, because I think on the group we might have 15, 20 people. I think what the importance is to reach the community which needs this most.
Yep, thank you so much. We will definitely take it, because that is our next steps actually. So we will see, and we all need your help. The 84 or 90 people are here, so you please spread the message. And then definitely, as Dr. Vijayendra Ingle said, that we are coming up with a leaflet with different languages. And if you wanted to translate into your own language, please do that. And we will try to work with the NGOs and see how we can disseminate to different people. So we will do our best and see how, and then probably we will also in contact with Mahendra Garath if he can try to contact us by email or by phone. Definitely we are always open. That is the reason why we are all having our day job, but definitely we wanted to make a difference, and this is the right time for us to do this difference, because all our motherland people are suffering, and this is the time which we can give, and we will do that as much as we can. So I would like to pass it on. If you have any further comments, please put it on the chat. I really appreciate that, because there are lots of important questions are there which we wanted to address. Over to you, Shobna, please.
Right. So carrying on from the asymptomatic cases, any recommendations of the time gap for vaccinations for positive tested patients?
The question was like vaccination after testing positive. Is that correct?
That's right, Vivian. What would you recommend? When should they have their first vaccination, and what's the gaps?
Our guidelines here says around 6 to 8 weeks, not before that. So I would say 8 weeks, 2 months after that.
It can be left up to 3 months.
Kranti, is there anything different guidelines in India?
No, same 6 to 8 weeks after you contract COVID.
So in our hospital, just to add, Vijendra, we were advised 3 months.
Okay.
Even in the UK, up to 3 months.
Yeah.
And do you recommend any differences in the time gap between the first dose and the second?
Vaccine wise, I think the trials when they started, and all the companies when they have done the trials, it was around 21 to 28 days. And around that 1 month period was the thing. But situation was that like Covishield, AstraZeneca, Oxford, they found that when the vaccine was delayed a bit for maybe around 2 months time or 2 to 3 months time, then the percentage of efficacy had increased. And for the other reason that in the same period of time, we can vaccinate more people, and at least more number of people are vaccinated in first dose. So that were two reasons in which it was a little bit extended gap of around 2 to 3 months. But ideally, I think some vaccines like Pfizer and Moderna and the Sputnik, they say it's 1 month.
So
Right.
For Covaxin in India, sorry, for Covaxin, which is an indigenous vaccine developed here, it's a live attenuated vaccine. For them, it is 28 days. For Covishield, like what Dr. Vijendra mentioned, it is 6 to 8 weeks.
So just one of the reasons people are asking this question is now there is some shortage of vaccine in India, and the second dose for many people are delayed. So please don't panic for people where the vaccination is delayed. Of course, it's better if you get the second vaccine on time. But in UK, everyone got their second vaccine after 3 months. So there is evidence that the first vaccine does have efficacy up to 3 months. So don't panic. If you can get it before 3 months, within, as Dr. Kranti said, in 28 days, if you can get your second co-vaccine, it's brilliant. But if you can't get it, please don't panic. We all had our vaccines after a 3-month gap.
Thank you. I think the next question is about, do you have to go for a blood test, a COVID test profile again, and a CT scan after your 14 days of isolation?
No.
No.
Straightforward. So the other one is about, I think you dealt with the asymptomatic patient for a period of isolation who tests positive. Do you have to go post-COVID recovery? Is there any chance of relapse, particularly where the patient feels, does feel has the symptoms of COVID still?
Yeah,
So
there are a few.
Sorry.
Yeah,
sorry. So yes, there is evidence. A very, very small proportion of patients can get a relapse. And I have seen it at workplace as well. And majority of them still have only mild symptoms. Please remember that. And there are various reasons why you get a relapse, but it's extremely rare. In theory, yes, you can get it. So the best, again, going back again and again to the point, is the best way you can protect yourself is vaccination. And that's the whole idea. One of the questions was, after, if I had COVID, should I have the vaccine? The answer is yes, after the required time gap. The reason is we don't know how an individual's immune system responds to the infection. In some patients, the immunity could be, the response should be so good that even without vaccination, they may be fine. But in majority, it may not be the case. And vaccine gives a defined and more or less a guaranteed period of protection. And that's the reason for vaccination. And that's the best way you can prevent the relapse.
Thank you. I think we nearly finished most of the questions, apart from this one by Dr. Cashel, which says, which and when, at what sign and symptoms, blood thinners to be started? Similar cases in the second wave in UK. It's in the chat, principally.
So mild patients or asymptomatic patient, they do not need blood thinners. And the best way to deal with them is hydration and mobilization at home. And even elderly people who don't walk around too much, they need to exercise their legs, just moving their foot and bending their knees is good enough. So in UK, the guidelines for use of anticoagulation is only for patients who need admission. So we are talking about moderate to severe cases. And so those are the only patients who need anticoagulation. Patients who are at home on home isolations are generally mild symptomatic patients. They do not need anticoagulation. There's no role for it.
There's just one more question with regard to the vaccinations. For example, if you missed the second dose, but now are suffering from coronavirus, how many days or months should you wait before you have your second dose?
So it's the same. So they have to wait for 2 to 3 months after they diagnosed with COVID.
So after they recovered, right. And I think one more question is, please tell us what should be done by people who are prone to regular cold due to climate or dust and nose blockages, etc., problems in the pandemic time.
So nothing different. So if there are people who take antihistamines for their normal, it sounds like a hay fever or allergy, they can continue taking the antihistamines and they can still have the vaccine. There is no issues with that. And it doesn't make them more prone for COVID, or it doesn't protect them from COVID either. The risk is the same as a normal population.
Great. I think we just have, I think Prashant who's got his hands up. Ganesh? I know we're running over time.
Yeah, sure. I think we got a couple of more questions. Most of the questions been answered, so I've taken off the second list. One of the question is, any vaccinations in pipeline for children below 18? That's the one question.
Yes, there is studies going on. There are
16, sorry.
Sorry, just to know, there are studies going on now. They are recruiting children for the vaccination studies, and Covishield or the AstraZeneca one is one of them being tested. So it is in the pipeline, yes.
And is there any direct link between vaccination and heart attack or cardiac arrest?
No.
No.
No. So there is, unfortunately, for people who don't know, one of the very famous South Indian comedian actors, he had an MI a day after his vaccination, and unfortunately he died. And there was a lot of wave created by this. In the medical fraternity, it's well known he did have cardiac disease before, and he had severe arterial disease, cardiac arterial disease, and that's what caused his heart attack, and it had nothing to do with the vaccine. So there is no evidence it causes heart attack or any harm to the heart.
And if a feeding mother is tested corona positive, does the baby of 5 to 6 months, will that baby get the coronavirus because she's feeding?
May not necessarily be due to the milk, but it could be because of the close contact.
Yes. I mean, there are various guidelines given by a few international organizations on this. Basically, you take the same precautions in terms of hand hygiene, everything when you handle the baby. yes, as Dr. Venkat mentioned, it's not known to secrete through milk, but through your contact, there is a risk of infecting the baby.
Okay.
So for those lactating women who unfortunately have contacted COVID, please don't panic again. Fortunately, the children are even less likely to be affected severely because the numbers of children being affected are extremely small. It's extremely important you take precautions, and if you can protect the child from getting COVID, it's good, of course. But if it is too late, then again, don't worry. Most children have very, very mild symptoms. In fact, majority of the children are asymptomatic.
And I think just another one on vaccinations is, what's the validity duration of vaccinations for immune boosting? Is it like 9 to 12 months or so? I mean, when do you have to take a repeat vaccination, for example?
We don't know yet.
I think I can take this because vaccination wise, already UK has already planned for a booster dose in next 6 months time. So usually the studies are still going on, like how many days or months it will be required and how much immunity you will have and how long will it last. The studies are still going on, but already our side, we are waiting for the booster dose to come in soon.
Okay. I think there are a few people who want to ask question in the list. We can start with Prashant Ingle. You can unmute yourself, please. And I think there's only 2 people at the moment, so we can cover them up as well quickly.
Yeah, first of all, I would like to thank ICYE for giving me this opportunity. I am Prashant Ingle. I am from Maharashtra, and I am a former Senate member of Mumbai University, and rightly, I'm working with the political party. I'm the bearer of a national political party. Basically, I have no question to raise because I have heard from all the 4 doctors and my all queries have been sorted out. I just wanted to add one more thing, which is very important, that ICYE is trying to send some flyers. So I'll be very glad if they'll give me this opportunity to distribute these flyers at the mass level. I just wanted to add this information. That's it. Thank you.
Cool. Thank you. Thank you very much.
1 second, Ganesh, sorry to break you. Dear Prashant, I have in the chat, we have given our email address, admin@indiancye.org. If you can email your details, definitely we will send the flyers. And in our email response, we will also provide you the contact details as well, in case if you need any WhatsApp or anything to contact us. So I hope it clarifies, and we will make the immediate initiatives. Thank you.
Thank you.
Thank you very much. And obviously, there is one more question asked in the chat, which is again about the video. So as Dr. Satish mentioned, we're definitely going to come up with some guidelines and some videos. Surekha ji, you got one. I think you are the last one to ask the question. Please go ahead.
Yes, sir. I want to ask a question. Sugar patient, they will take the insulin. After that, they should take the vaccine or no?
So there is no contraindication for not taking vaccine. If somebody is on insulin therapy and has to take a vaccine, there's not contraindication.
So essentially, please have your insulin as normal when you're going to have your vaccination, for your vaccination.
Okay, before means morning I'll take the insulin, then afternoon I can take the vaccine?
Yes. So whenever you normally take the vaccine, take that, and whichever appointment you get, morning or afternoon vaccination dose, go for it. It doesn't matter whether you take the vaccination in the morning or afternoon, but it's important you take your insulin as normal.
Okay, thank you, sir.
Okay, thank you very much, Surekha ji. I think one more last, let's make it a last question from Mayur Nagrale. Please unmute yourself.
Yeah, hi, it's Mayur again. I have a question. You know, when recently my family, they had COVID, and when we had a report from the authorities, there were some measurements. I'm not able to recollect very specifically what measurements they were, but for some of my family doctors, they mentioned that, you know, it measures the amount of infection your lungs have. So I mean, like my mother had 30, and my the elder son's daughter had 33, and my brother, he had about 17. So they said that 17 been highly infected. So would you be able to give a little bit more insight into how this is measured and how critical it is for people who are doing it in the house and people who don't understand it, is to convey a message of how it can be done at home?
Kranti, are they referring to CT score, I think? Am I right?
I think, yeah, something of that kind, which determines the level of infection that you have.
Yeah. So it's in the main score, that's used in India is the CT score, the CT severity score.
Yeah.
And then they grade it between 1 and 5, 5 being the highest. As I mentioned earlier, there is no correlation between the severity of the CT and the patient's symptoms. A patient with a low CT score can have severe symptoms and vice versa. All patients should follow the strict isolation guidelines and protect the other household members. So they're all equally infective until the 2-week period when their isolation finishes. So everyone has to take equal precautions when protecting other household members.
Lovely.
Okay, thank you very much. I see. Thank you, Mayur. I see Ankit. You can unmute yourself, please.
Thank you, sir. I am Ankit Thomas from Modinagar, Ghaziabad, and I am a medical student too. तो मेरे को बस हिंदी में सही मेरी क्वेरी है, तो मैं जानना चाहूंगा कि जैसे अभी सर ने बताया कि कोवैक्सीन जो है वो 28 डेज एंड कोविशील्ड 7 to 8 डेज की है, तो आफ्टर वैक्सीनेशन क्या ये चांसेस हैं कि कोरोना हमें नहीं होगा, या फिर लिटिल चांसेस है कि किसी कांटेक्ट में आने से हम लोग फिर से इन्फेक्टेड हो सकते हैं?
I can take that. Okay, Ankit, good question. अभी कोरोना का जो सिचुएशन है, अगर आपने वैक्सीन भी ले लिया है तो इसका मतलब ये नहीं कि आपको कोविड होगा नहीं, हो भी सकता है, और हो भी गया तो भी उसका इंटेंसिटी इतना नहीं होगा, माइल्ड टू मॉडरेट सिम्टम्स हो सकता है और वो सिवियरिटी में नहीं जा सकता है। ऐसा वो स्टडीज जितना भी हुआ है पुराना, उसमें वही दिख रहा है। सो अगर वैक्सीन ले लिया है, एक वैक्सीन भी अगर डोज मिल गया है, कोवैक्सीन हो या कुछ दूसरा कोई भी वैक्सीन हो, तो भी आप सेफ्टी वाइज, एफिकेसी वाइज मोर देन 50-60% तो डेफिनेटली सेफ्टी में हो जाते हो, और उसके बाद अगर होता भी है कोविड तो भी वो माइल्ड टू मॉडरेट ही होता है।
Can I just answer this as well, Vijendra? Yeah, thing is like Dr. Vijendra is absolutely right. My parents in Bangalore back home, after having vaccination for 2 to 3 weeks, they have got COVID now. And my father is about 80 years old, and my brother was also about 50. They both had the vaccination and they got tested positive, but they both are very minimum. They don't even feel that they have the COVID, but they're still isolating at home. They are not coming out, isolating not at home, isolating in a room, actually. My mother is tested negative. So absolutely back with Dr. Vijendra Ingle is saying, and I just wanted to tell in English for people who have asked the similar questions. Thank you so much.
Thank you. Thanks, Ankit. The next question we can pick up Shobha. Do you want to?
Hi, thank you so much for this opportunity, and this is a fantastic initiative. Thanks for organizing this. So I have a question for you guys. So actually, in India, the medical professions, doctors are absolutely overwhelmed providing services and so on. So is there a possibility, because I'm actually currently working with another team from Canada, and there is a kind of some physicians have come together And there's a platform we are launching middle of this week, which allows doctors, if you have time, spare time, you could probably give advice to patients. So the patients are actually through virtual platforms. It's just having patients in the waiting room. If you're free, if you're available, that you can just register there and say, yes, we are. And then, it really to give doctors in India a hand. So this is an initiative which is going to be launched middle of this week. Would be extremely grateful because we're looking for physicians, doctors all over the world who can come and help out in this crisis. So I'm sure this requires a detailed discussion, but that there is an opportunity out there. Is this something you would consider?
Can I answer this?
Sure.
Yeah.
Good to see you, Shobha. It's good to see that you have opened ICYE in Canada. Actually, we've been discussing about this for the past few days or so. And it's actually, it's already in the pipeline. However, if there is a platform available, the whole thing can speed up. So in terms of clinicians, yes, we have quite a few clinicians who will provide, again, make themselves available, when slots are available and so on. So it is all to do with the platform. So I'm pretty sure that other colleague speakers, well, they also have the same views. So, but there are a number of other doctors we know we have already approached are very keen to contribute. So it's really great to hear that you're already way ahead of us and you are in the process of developing that platform. Yeah, we would love to.
Thank you so much, Dr. Venu. They've already developed, the platform is ready. It's just, we're pretty much going to press the go green button on Wednesday. I will take this on a separate call with you, maybe. I'll connect with you. And it would be good. We are looking for a lot of help in terms of physicians coming to do it. So I already got a message. Thanks a lot, Shobna. And Dr. Venu, it's lovely to see you. And amazing service. Thank you so much. You keep inspiring us. Thank you,
Thank you. Thank you very much. Thank you very much, Shobha. So next question we can pick up from Piyush. We are running out of time, so maybe we can take one or two questions only. Piyush Sharma, do you want to unmute yourself, please? Okay, I think he's not there.
Yeah,
we can go. Oh, he's there.
Yeah, can you hear me? Yeah, can you hear me?
Yeah.
Yep. Okay.
Yes.
Sorry. Just a quick question. So I've heard from a lot of people that before taking a vaccine, we should take a paracetamol or something. So, but I was reading some blogs and they're suggesting that the both are inflammatory and it's not right to take the paracetamol before you go for a vaccine. So please share your thoughts and guidance.
Okay, I can tell about this.
Yes.
Thanks, Piyush. I don't think you need to take any paracetamol tablet before you go, and after taking the tablet, after taking the vaccine also, you don't need to take until you feel some body ache or headache or uneasiness. Then only you have to take paracetamol. Otherwise, you don't need to take anything.
And also, there's no cross interaction as well. Is that if someone is taking, there's no cross interaction. You can still take.
Okay, thank you very much. The last question, Hemlata Thakre, do you want to unmute yourself, please?
Hi, so can I just congratulate the organizers, the ICYE, for an excellent session. I think this was much needed. And I hope that you will actually repeat the session so that more and more people can actually take advantage, and with direct communications and interaction with clinicians and everyone from the team. It's going to be one way forward for information sharing, which you can't do too much anyway. I had a comment, really. You had one of these politicians, I think he was asking about patients going into hospitals and trying to find beds for them. One of the things perhaps that comes to my mind is, as perhaps a public health gesture, one thing that we were able to I'm a clinician and a close friend of Vijendra working in the UK. One of the things we were able to ride the second wave was not just vaccination, but the fact was strict lockdown. And the reason why people followed the lockdown rules was the furlough scheme and the amount of money that the government was helping people to stay at home, to be honest, which is obviously not possible in India. So perhaps whether it is NGOs or local politicians, what they could do is when somebody is COVID positive and home isolation, perhaps these people are not able to even get, we are talking about oxygen saturation monitors. I mean, it's not something which somebody in the slums or our maids or our drivers or whatever it is, they are not going to be able to get those and to be able to monitor those. You can imagine their panic. People are telling them, do this monitoring, it should be under 94%, and if it is over 94%, you're okay. Maybe, just packs of paracetamol and oxygen monitor, SATS monitor, these are easily sterilizable. So they are not disposable. They're not one-off instruments. The whole family can use that. And then once that family comes out of isolation, it can be passed on to the next. So it's some kind of an initiative to help them to look after their own health. I think that might be a suggestion. Just it's something which comes to my mind. Thank you.
I agree entirely, Hemant, with your suggestions. Just to let you know, from our college in Chennai, Kilpauk Medical College and Stanley, we've already started organizing these kits. We call it COVID kits, and we've raised funds for it, and we've been distributing it around 12 villages around Chennai as an initial initiative, and that includes a saturation probe as well. The saturation probes in India are available quite cheap at a very cheap price. So it is feasible. And I think equally important as well, the NGOs and other organizations should try and help to put food on plate for these poor people who are going to be without job as long as the lockdown is going to be. That's equally important. How successful the lockdown is going to be dependent on how these poor people are looked after. So it's very important that that is also focused, and there are efforts to put food on plate for these poor people.
I cannot agree more with you. I mean, I think that's going to be the key to coming out of this horrible second phase that India is seeing. And in fact, even in the UK, actually, if you look at it, of the population and the deaths, the mortality has been 2 to 3%. So it's not that, UK has it's just that the population is less, and so therefore the numbers are less. It's not that there were less deaths.
Yeah,
absolutely. So, and inevitably for India, it's going to be more. I mean, currently I'm seeing here is basically, even if you look at twice the reported deaths, it's still about 1 to 1.5%. So we are okay, but the numbers are going to be more because the population is more.
Right. Okay. Thank you so much.
Thank you so much.
Yeah.
Lata, thank you for your excellent input. Just wanted to tell something about this slum and poor people who cannot have access. I think that was the Dharavi pattern which Mumbai has used. Dharavi, the largest slum area, they were like packed people in that house area. So they have taken those people and isolated them. Whoever was positive, they were isolated to the school and halls and other thing, and they were isolated and monitored. So such system could be used in slum areas where you can isolate in a different protected area, but monitored by the authorities. One thing. And second thing about the support to people who cannot, because of the lockdown, cannot have food on the plate. So in that situation, I think there are few organizations in Mumbai and my hometown Aurangabad where they are providing a pack of food with like wheat, jowar, rice, oil and everything in one pack and giving to the houses. So there are such people, organizations doing genuinely work. So I think ICYE can also take a leap and support these people to get packed food or at least some packs to their house when there is a lockdown.
I think I understand that, and it's all is happening on an ad hoc basis. If it can be done on a more strategic basis and using the local politicians and the village elders and everything, and plus NGOs, I think that's the way forward. I think. Okay, but thank you very much. It was an excellent program.
And also to answer one more question you asked, Premlataji, about future webinars. Yes, there will be one in 2 weeks' time, and that will probably continue. So the next one in 2 weeks' time will be more on intensive care, inpatient care related topics, yes, those are in the pipeline.
Thank you very much. Yeah, it's a pleasure. It's been a pleasure. Thank you. Yeah.
Thank you. Thank you very much, Hemlata Thakurji. I believe we are closing the session for the questions. I think Ankit, you said you have one more question. Do you want to ask it quickly before we close?
Yes, sir. मैं ये जानना चाहता था कि जैसे हम लोग एजुकेशनल जो पीपल्स हैं वो लोग तो कनेक्ट कर सकते हैं चाहे वेबिनार के थ्रू हो या फिर मोर अबाउट कहीं से किसी डॉक्टर के थ्रू, बट जो विलेजर्स हैं जो गांव के लोग हैं देवर जस्ट वो हमेशा ये बोलते हैं कि आप क्या है ये कोरोना है वैक्सीन और नॉट, आप मतलब उन लोगों तक हम लोग ये बातें पहुंचाने का पूरा कोशिश भी करते हैं, करते भी हैं, कैंप भी ऑर्गेनाइज हो रहे हैं, बट वो लोग समझते नहीं है, तो हम लोग उन तक कैसे मोर कनेक्ट कर सकते हैं?
थैंक यू अंकित जी, मे बी आई कैन आंसर योर क्वेश्चन. सो उसके लिए हम लोग ऑलरेडी प्रिपरेशन कर रहे हैं. हम लोग कुछ वीडियोस बनाने वाले हैं, कुछ ऑनलाइन डिजिटल ब्रोशर्स बनाने वाले हैं, और उससे बस हम लोग जितना हो सके उतना ज्यादातर लोगों तक पहुंचाना चाहते हैं. एक बार वो रेडी हो गया, इट्स ऑलरेडी इन वर्क. सो फॉर अदर पीपल हु डिडंट अंडरस्टैंड द क्वेश्चन वाज हाउ वी कैन रीच आउट टू द रूरल एरियाज, remote places where people are not very much into digital technology. So we are in a process of discussion where we're going to come up with some brochures and some short videos for people. So thank you very much.
Shall I submit 2 minutes regarding Hemlata's question? What she just asked about what I have tell about the situation. She tell us what we are politician and other guys are doing. Yes, we are running the cooked food mass kitchens. We are converting schools into the COVID centers. We are trying a lot, but the population is too large, so we can't help. We are helpless also now.
That's true. Yeah, true. Yeah, thank you very much for the details. So I can move down. I can pass down the session over to Siddharth. Siddharth, are you online? Hello.
I am okay. Online. Right. Can you see me? Can you hear me?
Yeah.
Right. Hi everyone. I'm Siddharth and I have been with ICYE since its inception. I thank you, all of you, for joining here today. People from various parts of India, and I know that the situation is very desperate. It is very tough. We are going through the most critical phase of this virus in India. We have been here in this country through the critical phase, at least for the moment. And that's why we wanted to share the experience. And I really do appreciate the questions and suggestions put in by each and every person, each and every Indian, each and every person in India as on our minds at the moment. And we will try to reach each and every person. Yes, we agree that the population is vast, and at the same time we have to reach the rural parts of India as well. And that is why that is one of the aims of such sessions, that gradually we would like, either through those who are participating like Mr. Gharat, Mr. Ingle, and Mr. Prashant Ingle, Mr. Gharat, and all others like Sandeep Barwe, and there are many organizations who are working on field, and we would like to reach through each and every household as much as possible, to each individual as much as possible through sessions like this. And we are going to do more sessions like this, and also we will take all your suggestions, like making the videos, 2 to 3 minutes videos, and getting them on social media. So once again, I thank you all. I thank the doctors for taking their precious time. And I also thank all the participants and all those who have joined the meeting for taking their precious time as well, because every single minute for our beloved motherland, for our country is important. And we are in this with you and with everything we have at our disposal. So if you have anything, as Satish said, if you have any queries, please send us emails, please get our numbers, and you can even contact us by WhatsApp, by whatever means you can. So thanks once again for joining in.
Thank you so much, Siddharth. And Dr. Vijendra has kindly made some more availability as well. Wednesday, if you still have any unanswered queries, or if you need any, if you or your friends have consultations, we would be opening the platform on Wednesday. There's no presentation or webinar. It will be on consultation, virtual consultation. There's no guarantee for beds or anything which we can't give, obviously. So we will have a private consultation. Vijendra, can you please tell me your availability on the time you mentioned?
Yeah, I think that's the time should be okay. Wednesday, 4 p.m. to 6 p.m. UK time. That's 4 means 8:30 to 10:30 India.
Yeah. So we'll try to help him out, and then we will send out the Zoom link in Facebook and WhatsApp, and then also Mr. Ganesh will give the flyer. We will do as much as we can. And if you wanted to participate, please also send us an email. Then we'll try to arrange the flyers. And finally, one final announcement also, like after seeing all these things, our ICYE President Tejinder Sekon kindly said that he would like to contribute some very, very significant amount for COVID heroes. So if you can identify some really good people who are helping the society, so we were able to, as an ICYE, we would be able to award some as a credit. We would be able to give something special to them. So, and finally, I would like to conclude this session. Thank you so much, Siddharth, for your closing remarks. And any questions or any comments, please reach us by email. And we will be in touch with, again, as Dr. Venu said, in another 2 weeks' time, we will be doing another session, and the date and time will be sent shortly. Thank you so much. And may I ask kindly that we asked for a 1 hour session, and the doctors and everyone were patiently asking your things. Can you please unmute yourself and clap the hands if you can, please? Thank you for their patience.
Thank you.
Okay, thank you
Thank you very much, everyone.
Thank you so much. Thank you.
Thank you.
Thank you very much.
Thank you,
joining
Tejinder Bhai, for organizing this.
Thank you all
wonderful
doctors,
session.
organizers, ICU team. Very nicely organized. Congratulations. Successful seminar.
Thank you.
Thank you. Thank you, guys.
Dr. Venu, Dr. Rajendra, and Dr. Venkat.
Thank you, everyone.
Bye-bye. Have a good evening.
Bye.
Okay.